Hello, everyone. I'm Mrs. Anita Johnson, your program director here at CHCP eLearning. Welcome. Today, we're going to dive into what I consider the very foundation of your future career, medical terminology and anatomy. This is where it all starts. We're going to move beyond just memorizing words and really start speaking the language of medicine with precision and with confidence. You know, I always say that medicine is a precise language. And the best part is, just like any other language, it has a structure, a grammar that you can absolutely learn. Once you get that framework down, all those complex, intimidating terms, they suddenly become so much simpler to decode. And that is the skill that turns uncertainty into real, genuine understanding. So here's our game plan for today. First, we'll talk about why medical terminology is the universal language of your profession. Then we'll get into the fun part, decoding its structure piece by piece. After that, we'll take a quick tour of the body's systems, see how all this knowledge builds that unshakable clinical confidence, and then we'll tie it all together, connecting it right to your success on the AMCA certification exam. Okay, let's jump right in. The language of medicine really boils down to two things: precision and professionalism. Getting this right isn't just important, it's absolutely essential for communicating clearly and safely with doctors, with your clinical teams, and, of course, with your patients. I really want you to stop thinking of this as a big memorization task. Instead, think of it as learning to speak the professional dialect of your new career. It's the common ground, the universal language that connects every single person in healthcare, from the person at the front desk all the way to the surgeon in the operating room. So, how in the world do we decode it? Well, the secret is understanding the grammar of medicine. You see, most medical terms aren't just random, scary words. They're actually built from simple, reusable parts that fit together in a way that makes perfect sense. Let's start with the first piece of the puzzle, the prefix. This is a little word part that gets attached to the very beginning of a term. It kind of sets the stage, you know? It often tells us about location, like where something is, or about time, or a number. Think of it as the signpost for the rest of the word. Next up, you have the root. Now, this is the heart of the word. It holds the fundamental meaning. Most of the time, the root refers to a body part, an organ, or maybe a condition. This is the main subject of our little medical sentence. And finally, we have the suffix. This piece gets tacked on to the very end of the term, and its job is to tell us what's happening. It might describe a procedure, a specific condition, or a disease. The suffix is what completes the thought and tells us the action. Okay, let's see how this all clicks together with a real word, like subhepatic. Sub is our prefix, and it means below. Hepat is the root word for liver. And ic is a common suffix that just means pertaining to. So you put them all together, sub, hepat, ic, and it simply means pertaining to below the liver. See? No guesswork needed. It's perfectly logical and clear. All right, now that we have the basic tools, let's put this knowledge into practice. We're going to take a calm, guided tour through a few key body systems. This is where we get to apply those new decoding skills and really see how these root words show up in a real-world clinical context. We'll start with the cardiovascular system. Now, just like its name tells us, this system is all about the heart, cardio, and that huge network of blood vessels. It's basically the body's internal highway, right? It transports life-giving blood everywhere it needs to go. Just recognizing these key roots is a total game changer. When you see cardio, your brain should immediately think heart. Vascular and angio both point to vessels, and hemo has to do with blood. Seriously, just these four roots will help you unlock so many terms you're going to see every single day. Now let's transition smoothly over to the system that keeps us all going, the respiratory system. This amazing network includes our lungs and all the airways that bring that vital oxygen into our bodies with every single breath we take. And look, here again we see that powerful pattern. Pulmo is your main root for lungs. Broncho refers to the bronchial tubes, those major passageways for air. Pneumo can mean either air or lungs, and tracheo points right to the trachea, which you might know as the windpipe. Our final stop on this quick tour is the digestive system. This is the system that's responsible for that incredible process of turning the food we eat into the energy our body needs, all the way from the stomach, through the intestines. So let's break down the core roots here. Gastro is going to refer to the stomach, entero to the intestines. We've actually already met hepato, that's for the liver, and colo logically refers to the colon. Just knowing these will give you so much clarity when you're reading patient charts. Okay, now let's connect all of this directly to how you'll perform in a clinical setting. Because this isn't just about passing a quiz, it's about making that crucial shift from knowing something in a textbook to acting with confidence as a professional. This right here is the transformation we're aiming for. On one side, you've got the uncertainty and, frankly, the risk of error that comes from just guessing. But on the other side, you have the clarity and the professional accuracy that comes from confidently decoding a term. This is the very foundation of patient safety and of your own competence. And the benefits of becoming fluent in this language, they are so tangible. It's going to directly improve the accuracy of your documentation. It gives you the power to educate patients more clearly. It absolutely strengthens your communication with doctors and nurses. And maybe most importantly, it builds the trust and comfort that are so essential for excellent patient care. And where does all of this lead? Well, it leads directly to your next major goal, succeeding on that AMCA certification exam. I can't stress this enough. The skills we are building right here in this module are a critical, non-negotiable part of that exam. And please remember, a strong foundation in this language isn't just about passing one test. It is an essential skill for your entire career. It gets you ready for the AMCA exam for sure, but it also supports your professional growth for many, many years to come. So, I'll ask you, are you ready? Are you ready to take this knowledge and build on this incredible foundation? You now have the tools you need to decode the language of medicine and to step forward with real, earned confidence. I'd truly encourage you to continue this journey with us in Module 3, where we're going to build even more on what we learned today. Thank you so much for your focus and hard work, and always remember our motto at CHCP: accredited knowledge builds certified futures.